Alrighty, we're glad to have you back. It's been 12 months since we last saw you. Well, I'm glad you're here today. So today we're going to be doing your perio maintenance cleaning, and we're also going to be measuring your pockets, and we'll be taking your bite wing x-rays. And then after I clean your teeth, we'll be applying the fluoride varnish to strengthen your enamel and prevent future caries formation. It's also good for the generalized sensitivity you're feeling around those recessions. Yeah. So let me just check what we have in your file. I see that last year you were diagnosed by the doctor as having caries on two of your teeth on the right side, which are number 30 and 29, but we were not able to complete those. So today we can do that. And also, upon checking here, the doctor saw, he noticed that the tooth number 29 on that same side went slightly deeper, so we are going to be using a cord to help with preparing the tooth for filling. He also noticed that the caries on one other tooth on that side, number 30, has progressed and is deeper compared to last year. So with that being said, we may or may not need a crown depending on how deep it had become. So, and we'll also be placing a liner. It's called a Theracol to protect your pulp. For the material, you have the option of using the white resin composite or the silver amalgam. What would you prefer? Okay, composite is good. Yeah, we'll use composite. So just so you know, composites usually last between 5 to 10 years, and for the amalgam it's going to be 10 to 15 years. But it also depends on things like whether you've fractures, recurrent decay, or occlusal stress, that these materials may vary in terms of lifespan. And with the clenching and grinding that you have going on, I do recommend using a night guard to prevent further damage to these restorations we're going to be doing, and to your teeth in general, to protect them. You also mentioned that you feel pain upon biting on the lower left. When the doctor checked, he found that tooth number 18 on this side needs a crown and he has an incomplete fracture. So for the material on that side, we can use either a zirconia or gold. So although zirconia is more aesthetically pleasing because it's the same color as your teeth, it may cause more damage to the opposing teeth, especially on the teeth next to it, which is number 15, because it's a harder material compared to gold. But gold does not cause as much wearing to the opposing teeth and is more costly though. So since we have the clenching and grinding going on, like we mentioned, I would highly recommend to use the gold crown. Are you okay with that? Already. So we are going to be filling the two teeth on the lower right side, and then we'll arrange to do the crown on the left side on a different date, okay? Already. Alrighty, so we did your filling, and we're gonna let you go for now. If you need ibuprofen or Tylenol, we have it in the back clinic. I can get it for you. You can take one before you go if you want. Alrighty, and then for as a home care instruction, expect the numbing to wear off in the next couple of hours or less. If the restorations feel high, please give us a call so we can adjust the bite for you. It's normal to have some sensitivity to the procedure, especially if the caries were deep, like yours were deep, so you may feel some sensitivity around them. But you can use warm salt water rinses. They usually help, and you would need a cup of warm water for that, together with 1 or 2 tablespoons of teaspoons of salt to decrease the edema and to soothe the tissues. And then if you're exercising, keep it at a minimum today if possible, because exercise can make a newly restored teeth hurt